function on Zoom for any comments or questions. We'll be monitoring that. Gives us a hard copy to get back to you if we don't get to your question. But we're ready to start here. And welcome to our Overcoming Vaccine Hesitancy webinar. And without further ado, here's Al Lewis.
Thank you very much, Mark. And one question we always get that hasn't come in the chat box yet is, why is Scooby-Doo and Mr. Ed on our title page? The answer is, it's a dog and pony show. With that, I will introduce our panelists. And first the agenda. We'll introduce our panelists. Then we'll talk about, how much of a thing is this? Then we're going to get into the conversation that will be spurred by questions for the audience and also questions from the audience. So what are the objections? What do your employees need to know? How do you teach them? And we'll have our panelists answer that. Our first panelist, special guest star, is Dr. Christa-Marie Singleton, who is the Associate Director for Science and the Science Lead in the CDC's COVID-19 Response Chief Health Equity Office, and the Senior Medical Advisor in the CDC's Population Health and Healthcare Office. And also, recently here today is you are, am I correct, the lead liaison with the commercial sector for these
that is correct, yes.
And with her, we have Dr. Scott Carter, who those of you who are on LinkedIn know that he's a constant presence, and I'm insanely jealous because he always gets more likes than I do. He puts being a family practitioner together with being a medical director for a number of corporations and some regional benefit coalitions. And as such, he's right at the intersection there, understanding both the employer viewpoint and the employee viewpoint. And Scott, I understand you have a book that has just come out or is coming out?
Yeah, I'm just getting ready to release. It's called Intuitive Wellbeing, and it's about living our life, taking control and being as healthy as we possibly can, because as you know, the best way to use the U.S. healthcare system is to not need the U.S. healthcare system. So we're going to talk about vaccines today, which is an example of a great way to not get sick and not have to go to the hospital and emergency room and things like that. And so it's about building those habits that keep you from having things happen that could have been prevented.
And first of all, that will get you a zillion more likes than I get on LinkedIn, but we'll also have you joining our webinar in July, where you can talk a little bit more about the book directly. So we have these two very highly credentialed physicians, along with myself. I don't even play a doctor on TV. My job is that I try to take healthcare information, and at Quizzify, we try to put it into healthcare quizzes that are easily digestible for employees. And we do this in collaboration with doctors at Harvard Medical School. And we will have some examples of that you will be able to answer. So first question, well, this isn't a polling question, but when we put out this notice for this quote unquote emergency webinar on vaccine hesitancy wasn't that much of a thing. There were a few articles about it. Well, I just Googled it yesterday. It's got 41 million hits on it. So newsflash, it is a thing. And with that, we are going to get out of this presentation and go right to the web, where we have our first polling. Let me see if I can make it a little bigger for you. Our first polling question, which is, can everybody see this okay? Because I'm having a little trouble making it bigger. There we go. Which of these presidents, and you will have a chance to buzz in a sec, shown here in their official White House portraits, did not receive and will not receive the COVID vaccine? Jimmy Carter, George H.W. Oh my God, I got the answers up here. Ah! All right, well, okay. We won't use it. Oh, okay, it covers it. So, so you can vote for Jimmy Carter, George H.W. Bush, George W. Bush, or Donald Trump. And while you submit your answers, we'll jump to the first question here. Actually, one just came in, and I think we're going to address this a little bit later, but should young pregnant women get vaccinated? Scott or Krista?
I'll start. Pregnancy in itself is not what we call a contraindication to getting the COVID-19 vaccine. So basically, in plain language, if you are pregnant, you are eligible to receive the vaccine. What we do know is that pregnancy pregnant persons have actually had some worse outcomes from COVID itself. The vaccines have been tested in pregnant women, and to date, everything has been fine in terms of them being safe. And so, in light of the fact that pregnancy in itself with COVID has been shown to have some more severe outcomes, a pregnant person may definitely want to have that conversation with their healthcare provider to make sure that that's a choice for them. And then if they do go ahead and get vaccinated, one thing our experts have recommended is that pregnant persons consider taking acetaminophen after their dose or doses, because in some cases, persons may develop a fever, and fever with pregnancy has been shown to show some side effects. Scott?
Yep. Well, and it's so interesting, Krista, because there's so much confusion out there right now about conversation around infertility, which I know, Al, it's not really what you're asking about, but it directly is related to pregnancy, obviously. And the confusion is that a lot of the things we've talked about is when women get COVID, there's a significant risk, or it was posited there may be a significant risk of things happening around fertility and pregnancy, but that is not the case with the vaccine. There's been no real concern about the vaccine interfering with fertility. And as you just mentioned, in pregnancy, it actually is so much safer than having a woman get COVID.
Okay, so let's go to the answer here, Mark. Yes, the answer is George H.W. Bush. It kind of helped that we put the answers up first by mistake, because we were practicing on this question. And of course, we did get some votes for Donald Trump, but the reason that George H.W. Bush cannot and will not ever get the vaccine is he is dead. Every living president has got the vaccine. And notice that because we don't want to inject politics into this, we use everybody's official portrait, and we have all the incorrect answers have the exact same explanation there. So nobody thinks, oh, you're trying to slip a fast one here. Now, it occurs to me, and I'll ask the panelists, that actually Donald Trump, his recommendation has been more muted, but wasn't he a big supporter of pushing the vaccine along when he was president?
Well, yes, under his administration, the process of Operation Warp Speed and the creation of the vaccine processes did happen under his administration. And to our understanding, he actually did get vaccinated in January before he left office.
Yes, so every living ex-president has been vaccinated, and they all recommend the vaccine. So it doesn't matter who you voted for, they're all saying the same thing. Okay, the next question. There's some issue about the emergency use authorization, that the vaccine might have been a little rushed. So it was based on this messenger RNA technology, and the question for the group is, how long has the technology been in development before it was used for the vaccine? And while you folks are all voting here, we'll ask the question of both panelists. Can you describe how the messenger RNA vaccine works?
Yep. Chris, you want me to jump in, or do you want
Yeah, jump in there.
Okay, so it's very interesting, the different types of vaccines that are both able to be produced and which ones we're using for COVID. So the mRNA vaccine, what they're doing is injecting a small piece of messenger RNA into the muscle, and that actually is taken up by cells, and it has a protein produced from that very small piece of RNA that the immune system then responds to. So there's two things that are important in that. One is DNA is not involved. And as you all know, there's a whole lot of conversation out there about, does it change your DNA? And the answer is no. It has nothing to do with DNA. It's an RNA vaccine. And secondly is, can you get COVID from the immunization? Of course, the answer is no. No more than you could take a person's finger and have them spontaneously generate that finger generate into a human being. It doesn't happen. It can't happen. So there's no worry about getting COVID from getting this messenger RNA strand injected into your muscle.
So, Mark, do we have an answer on this? Yes, the answer now, remember, this group self-selects because you presumably are not here to learn this as much as you're here to learn how to teach your employees. So no surprise, we got the right answer 58% of the time. And yes, this, I think Moderna has been working on this for 10 years, but actually if you Google on it, you find that somebody in Hungary first discovered or invented this, like, I don't know, 40 years ago or something. Okay, next question is, oops, I got to actually, hang on a sec. I think yeah, I need to put down an answer in order to move on to the next question. All right, the next question is, we can trust the vaccine. It's a follow-up to this one, even though it may seem like testing was rushed because they had sequenced the vaccine even before the first cases were recorded in the US. This is very profitable, and the infection rate was so high that the clinical trials would be easy to interpret. And this time there are two correct answers. So gene was already sequenced, trillions in profit at stake, and the infection rate was so high that the clinical trials were easy to interpret. All right, so while we're waiting, let's ask another question, which is, we're talking about the vaccine and the RNA. Does it cover the variants? And I know that this answer seems to change all the time, but what is the current answer to that?
Sure, my mute's on. Right now, our feedback is that the vaccine is effective against the variants. As we keep waiting and testing individuals who unfortunately are still coming down with COVID, we're checking to make sure that there's any sort of reactions. But right now, the variants seem to be being able to be controlled by the vaccine. One of the, I think the flip of that question, why are variants occurring? Variants are occurring is because the virus is trying to stay alive. The virus is trying to find a new host. And so when it finds an unvaccinated person, then it will find that individual and change its outer coat or protection so that it can hide and be pretty sneaky. So the way to keep the variants down is to get vaccinated and make sure we don't have susceptible hosts.
And do we, oh, sorry, Scott.
No, I was just going to say, I think that Dr. Singleton raises a good point, and that is, it's not abnormal for viruses to have variants. In fact, it is normal. So while the general public isn't used to hearing about the variants of vaccines, probably, it is a normal way that viruses change so that they're able to survive, as Dr. Singleton was saying. So it's not surprising that we're getting variants, but what we've got to do, and this is a huge point that she made that I want to just repeat, is even young people who may not get significant symptoms or don't perceive COVID as being a danger to them need to go get vaccinated, because we've got to decrease to the greatest degree possible the number of opportunities the virus has to create new variants. And that's the way that we do that, is by having people not get sick. So even young people in your corporations, I've been on a number of calls with companies that have actually asked me to do webinars because they have so many young people that say that it doesn't matter if they get vaccinated or not. And that is absolutely the case. And by the way, one other thing that's interesting is that the CDC came out 2 weeks ago, I think, with variant designations, which I think is fascinating, Al. There's basically three. One is a variant of interest, which suggests that this is a change we need to pay attention to. There's a variant of concern, which through scientific research shows that the virus is more contagious or causes more severe disease. And there's a variant of high consequence, where the vaccines may not work or aren't being found to work in the future. Now, we're lucky right now, because as was mentioned earlier, there are vaccines, there are variants of concern, and like the United Kingdom one that was more infectious, but there are no variant of high consequence, meaning that the monoclonal antibodies, vaccines, and other things don't work well with them.
Well, I think you've just come up with some fodder for another Quizzify question. Mark, how did we do on this one? Oh my goodness. So yes, that is absolutely correct. In terms of profit for the drug companies, I don't know if anybody's noticed this, but this is not, they don't sell, first of all, they're free for the user. And that's another question that comes up sometimes. Sometimes there's a little fraud going around. Very few people will say, I can get you the vaccine and I'll only charge you $10. But a lot of people are saying, I can get you to cut in line for money. So anything in healthcare, there's going to be fraud. So now a vaccine question in general, because people are wondering about vaccines in general. Roughly how much have deaths from smallpox, diphtheria, polio, measles, and mumps fallen due to the vaccines? 70%, 80%, 90%, or 100%? And while we are working on that, this is probably my answer because it's vaccine trivia, but the first vaccine was actually invented in 1754. This would not pass any institutional review board right now, but the guy who did it, Edward Jenner, did it on his son. Yeah, good luck with that today, right? And the reason they call it a vaccine is that the prefix VACC comes from cow, and in fact they use cowpox to protect people against smallpox. But let's see how effective vaccines are in general. So, Mark, do you have answers for that one? Okay, well, Scott, since this was your question that I stole, would you like to take first dibs at why the majority is wrong for the first time?
Well, it's fascinating because when you look at it, smallpox, diphtheria, polio, measles are all 100% now gone because of vaccines. You have pertussis, tetanus, mumps, rubella, congenital rubella syndrome, and Haemophilus influenza that all are between 96 and 100% of the way eradicated. So rounding to the nearest number, that would be 100% of those. It's fascinating to me because in the years 1900 to 1920, 1,113,009 people died every year on average from those conditions. Today, they are, again, almost 100% eradicated.
Now, I know it's not always about me. My first wife was very clear on that, but it was, in fact, my very own uncle working for Dr. Singleton's very own CDC, who led the team that wiped out smallpox by going to Africa and finding, I think they administered some humongous number of vaccines to people. In my humble opinion, he should have won a Nobel Prize. Okay, the next question.
Hey, Al, real quickly, I want to go before we get too far away. I know that those of you who are listening, and we've got a great attendance today. Thank you all so much for being here. We talked about paying out of pocket and the fact that the vaccine is being administered at no cost to people. In the Kaiser Family Foundation, that was the #2 reason people aren't getting the vaccine, with 35 to 45% of people saying that they aren't getting it because they don't want to have to pay for it. So I just really, for the corporations on the call today, I want to make sure that you don't overlook that. And in your communications, please emphasize to people that they are going to be able to get the vaccine without cost.
That's a great, once again, more fodder for another Quizzify question right there. But Dr. Singleton, anything you want to add to that?
No.
Okay, so that brings us to another question that came up is, what would you recommend, and this is probably also for you, Scott, for reward, should people, actually both of you, how much of overcoming vaccine hesitancy in these corporations is education versus rewards versus requiring it?
Well, I'll start on our, one of the things with vaccine hesitancy is, there's probably 3 parts, is that it's understanding the process for how the vaccines were made, understanding what's in the vaccines themselves, as well as trusting the systems that do that. So a lot of the questions, as I'm rolling through the chat here and I'm seeing these questions, is taking the time to meet people where they are. And so companies that have allowed space for vaccine forums or allowing people to ask questions, events like this, is time well spent, because it helps people get to that first chunk of understanding what's in the vaccines and the process and the system that does that. So that is where we at CDC recommend to try to, that's what works best. At least that's what we're finding. The rewards, the incentives, etc. Several companies are doing that, and they may be seeing some results with that. But just understanding where people are is probably the most important intervention we recommend.
I have to agree.
Yep.
Yeah, I have to agree 100%. And that is that, what we have right now is we have a lot of misinformation. We have a lot of people that are scared, and fear is driving their lack of willingness to get the vaccine. So going into their objections and understanding them, and then meeting them where they are in their understanding. And, again, we talked about people afraid of the cost. People are afraid of serious side effects. They think they might get COVID from the vaccine. They're afraid they can't, they'd have to miss work because of getting the vaccine. If you understand their fear, and as a corporation, you control so many of those variables, you can help people overcome those dramatically. Again, I was mentioning, I do a bunch of webinars for corporations on this. And I can't tell you the number of emails or chat box conversations where they say, wow, thank you for addressing those. I'm going to go get the vaccine. I had no idea. And that is a common response by people who are working in corporations right now, particularly when they're working from home and somewhat isolated. So educating is incredibly important. Removing barriers for people actually getting the vaccine is where they're coming into work is very, very important. And then just really being a good listener and bringing them accurate scientific information. It's so important for me in my belief system to not convince or coerce people, but just give them the information and trust their judgment to do the right thing.
And I would add to that, that if people have been following the wellness industry, which of course is one of my obsessions, have probably noticed that incentives, large incentives, are generally associated with things that employees really don't want to do. So it may be the case that by paying them to do this, you're kind of convincing them that maybe this is good for the corporation, but it might not be so good for us.
Yeah, I was going to say there's a lot of things you see in the marketplace. And I see that one of the individuals put a question up here about rewarding somebody by giving them $500 to get the vaccine. Is that coercive? And I guess I'd have to look up the word coerce to really know if that fits in the strict definition. Where does encouragement end and coercion begin? And I think it's a very valid question.
It is, and actually it was a subject of a previous webinar on the EEOC and what is allowed in terms of incentives and penalties, and they've now changed that, and it's kind of beyond the scope of this one, but it's a very good question, and we'll get back to you on that. Our question box is being overwhelmed here, but let's quickly get in one more question, and then we'll go to some of the other questions that have come in. And by the way, if we don't get to your question today, we will get to it. Well, it'll probably be, actually through this rate, it'll probably be several days before you get all the questions answered and back out to you. So we talked about fertility. You have these 4 choices here. Which affects fertility more? COVID, the vaccine, both a fair amount, or neither much at all. And Mark, if you want to put the polling up there, there's one question I think I can answer, and you two can contradict me, because remember, I don't even play a doctor on TV. It says, if those diseases are 100% eradicated, why get vaccinated? I actually think that they've now no longer recommend the smallpox vaccine, precisely because it has been eradicated. Is that accurate?
That is correct.
Yes, score one for me.
Yeah. And I remember, if you remember, a lot of us have the big round nickel looking thing on the back of our arm because they used to come into schools and give it to us, and nobody has that scar anymore. So that's a good thing.
Okay, so let's see what the poll says. Okay, so actually there's a fair amount of misconception here, and I think Mark or Chris, I think you kind of hit on that, but even though you hit on it, it's probably worth reiterating, because we got a lot for neither affects it much, if at all.
I think Scott and you and I talked about this one, is that there's been several studies showing that COVID itself has had a reduction, has been shown to have potentially a reduction in sperm count. So therefore, if you get sick with COVID and there's a chance that if you're a male, that the sperm count can be lessened. So by default, then the fertility could be decreased. So what's the takeaway? Don't get COVID. So try not to take the precautions of wearing your mask, washing your hands, getting the vaccine, avoiding crowded places so that you will not get COVID or significantly ill from COVID. In terms of women and pregnant persons, the thought process is that COVID and pregnancy, we have worse outcomes. So again, for that one, we want to minimize the possibility that the pregnant person will get sick with COVID. And so therefore for them, they are eligible to get the vaccine. It is recommended for them if they and their provider choose to do so. Because again, pregnancy plus COVID equals less than good outcomes.
Yeah, I think that's well said. And again, the question that every person has to weigh is, which is more dangerous, staying at risk of getting COVID or getting the vaccine? And you know, the numbers don't lie. I mean, you've got a lot of people, I think there's a question coming up, so I won't give it away, but we've got a lot of people who've gotten COVID and we see the outcome of that. We've got even more, almost 3 times as many people, 4 times as many people who've gotten the vaccine and we see the outcome of that. So we'll come back to that in just a minute.
So just to wrap up on the smallpox thing, some naysayers have told me smallpox would have gone away regardless of the vaccine. What do you say to them? I think I can answer that one too, which is the #1 killer in history of viruses. It would not have gone away on its own. So next question, and this we kind of raised this one a little bit before. We talked about Advil and Motrin, ibuprofen, before or after you get the vaccine. And the question is it okay afterward? Okay afterwards, not beforehand. Okay beforehand, not afterwards. Both are okay. Neither are okay. And while you're answering that, you had mentioned some data. So let me just do a. Actually, this is a good one that came in. If obesity seems to make death more likely, why don't the CDC guidelines include losing weight?
Well, actually, we do not so much guidelines, but we point out that what are the underlying conditions and or behaviors that have been shown to show worse outcomes from COVID. And there is now a list on our website that shows conditions such as heart failure, and obesity is one of those, particularly obesity and with BMIs over 30. And so individuals that have had that underlying condition, meaning that they are in the obese category, have had worse outcomes with COVID, have had to be on ventilators more likely than others. And so again, starting to attack that underlying condition. So if we see that obesity is leading people to worse outcomes, in our guidance, we do have links to our programs that talk about healthy nutrition, healthy behaviors to try to get people to help address their chances of being overweight as well as being obese. But as we know that this obesity and being overweight is a national challenge. And so it's something that we all should be looking at.
Yeah, and so I'm going to take a clinical approach. Christa-Marie works for the CDC, and so it's more of a policy approach. I'm going to take now a very clinical approach, and that is that there's clear evidence that people with metabolic syndrome don't do as well when they get COVID. And so you've got to remember that obesity is a surrogate marker often for metabolic syndrome, which means that, when you're born, you have a certain number of fat cells. By 4 years old, you don't make new fat cells. They're supposed to get larger when you have access to a lot of food, say spring and summer, and smaller in the fall and winter, and they go atrophy and hypertrophy. But in America, we fill them up and then we keep going. And that's what obesity is defined as. So fat cells become saturated. The pressure when a person now eats a meal goes up in the bloodstream with the fat and sugar. It's not really what happens, but they kind of getting caught in the blood. And then that has a significant effect on your body's ability to metabolically or to operate normally. And so we know that, you know, when COVID came out, we thought we'd have a bunch of asthma patients and COPD patients and people who had respiratory problems in the ICU. We didn't have nearly as many of those as we did people with diabetes, people with metabolic syndrome, and obesity as a surrogate marker for that. So, and you literally, we as human beings, every 4 hours, choose how much pressure we're going to put on our bloodstream in terms of the calories we eat. So I would, for those people who are listening, for those at work, I honestly there's a lot of evidence that the choices that you make with the meals that you eat in terms of caloric content, saturated fat content, refined carbohydrate content, will determine the amount of pressure metabolically your body's under for the next 4 to 6 hours. And so with my patients that are overweight or obese, I very much encourage them to manage that well. And it's a perfect time to find another reason to decrease the kind of the stress of being overweight. And the way you do that ultimately is you ultimately will lose weight, but it occurs 4 hours at a time. You know, you don't lose 20 pounds, you lose a quarter of a pound, then a half pound, then a full pound. So I'd really encourage people to think that through, because we know that metabolic syndrome, which is related to overweight obesity, does increase the risk of a bad outcome with COVID.
So thank you very much for that. And now let's oh, and by the way, you know, they say you need to, oh, okay. So we have an answer here. We have, it's okay afterwards, but not beforehand, which I believe is the correct answer. Scott and Krista?
Yes, after.
Yes. Yes.
Okay.
Now, what about Tylenol, acetaminophen?
So really the question that's being asked here in the background is, if you have a drug that you know actually does have an effect on the immune system, should you be very careful about taking that medication, because it may alter your body's immune response. And that's the point of the Motrin, is it downregulates the leukotrienes and things, and so, or it shifts them, I should say. And so as a result, there may be a difference in your immune response. And by the way, the absence of data doesn't necessarily mean that it's going to hurt something. So in other words, if you're a person who took Advil before you went and got your shot, don't have a panic attack right now. You probably still had a great immune response and you're fine. But because it has not been studied, the medical establishment is saying, don't take it, or be really careful about taking it, because it may compromise your body's ability to respond to the little protein that's put in your arm, which is what gives you antibodies, which is what protects you. So as a practicing doctor, I know my patients very well. And so I will treat that individual with what I think is best for them. And if I know they're, you know, a person who has a great immune system, and in fact, they have such a great immune system that when they get immunizations, they're miserable and they get a lot of swelling for a couple of days, then I will recommend according to that. Tylenol, on the other hand, doesn't affect the immune system. So there's much less concern about a person taking Tylenol around getting a vaccine than there is Advil.
And while we're on the, first of all, while we're on the subject, I do want to ask about that fourth answer, Benadryl or Claritin, because I think there's a different answer there. But folks, we did mention not to put your comments in the chat box because we're not monitoring the chat box. They say you need to actually say something 3 times before people actually internalize it, which is, you know, one of Quizzify's things. We basically ask the same question a different bunch of times. So now we're on time number 2, and I'm hoping that will be enough. So please move all your stuff, including comments, to the Q&A. Can we just get comments from you folks, speaking of comments, on taking allergy meds ahead of time?
We don't have any data on that one. The only things that our sites are ready, the data we have is that people may want to consider Tylenol or acetaminophen for arm pain or low-grade fevers. If that happens to happen to you, it may not happen. You may not have that reaction after you take the vaccine.
So we have an answer here that just says, well, you can read it. It says you hang out for a while afterwards in case you have an allergic reaction. But if you've suppressed that reaction, you may have a reaction after you get home. And this was, we get our stuff reviewed by the Harvard folks, and they thought this was okay, but I guess I'll ask you too.
Well, it's interesting because first of all, I will tell you that as a person who runs flu shot clinics, we see no more problems or allergic reactions or fainting or anything with COVID vaccine than we do with regular flu shots. So to the degree the person's gotten a flu shot and you know how you react to that, it's probably going to be very, very similar. There are a couple of things that I've seen with getting COVID shots. One is that people tend to be relatively anxious. And so probably the biggest thing that we've seen is people hyperventilating or having some anxiety around getting the shot more than it's actually a problem with the shot itself. But the other thing that's very interesting is there's this thing called COVID arm. I don't know if anybody's heard about that, but my daughter's a doctor. My dad's a family doctor also. And you get the shot, you go home, you get some swelling and you get some soreness, like pretty profound soreness that can even feel like tingling because the vaccine is working so well, you're having a very strong reaction to it. And that occurs about 3 to 4 hours after you get immunized. So it's outside the 15-minute window that we have people wait. But it goes away within 24 hours. It's not a big deal. So, everything has its uniqueness, and that's something that we're seeing clinically in the kind of out in the private practices right now. People are getting.
So,
Yeah.
Sorry, did you want to add something, Krista? Okay.
No, I agreed. And that's why, again, the individuals, the 15-minute window was put there because, again, in the trials, if someone was going to have the 1 or 2 rare cases where someone happened to have an allergic reaction or hives or something like that, it happened within those first 15 minutes. So hence the caution period. And so in the screening process, clinicians will ask, have you had a severe allergic reaction where you require the use of an EpiPen or something like that? And if that's the case, then you are monitored for 30 minutes compared to 15 minutes. And that is how we monitor individuals. But to Scott's point, it's usually people hyperventilating or anxious. And we've seen individuals have to just working on calming them down and reassuring them that everything will be fine. And everyone goes on their way.
Now, Scott, you had mentioned before the importance of a balanced diet and not, for basically controlling metabolic syndrome because of the higher risk. But there are a lot of people out there who are pushing things to, quote unquote, boost your immune system. So the question that we're asking the group here is, which is the clear exception of things that could boost your immune system? Is it zinc, folic acid, vitamin D, or vitamin B21? And while we're waiting on that, we've got a zillion questions in the question box, and I don't want anybody to think we're ignoring them, but we also had a whole bunch of questions sent in advance, so we're just not going to get to all of them. This question is, I have heard people indicate that because they've already had COVID, they aren't going to bother to get the shot. Take it away.
Well, that is, we get that question a lot. And again, I kind of roll the dice like this, at least my advice on that, is that we do have cases of individuals that have gotten reinfected. So when you get COVID, your body produces a type of protection called immunity. We have had individuals get reinfected. And so therefore, we're not sure how long that protective immunity lasts. As Dr. Conard also mentioned, we also know that individuals who have had COVID, we know some of the side effects of getting COVID, and one of the worst side effects is death. No one has died from the COVID vaccine. And so that is why, even if you've had COVID before, getting the vaccine gives you protection so that hopefully you won't be reinfected.
And so I take a very pragmatic, practical approach to this again. So the good news is that people who got COVID, we've now been monitoring their antibodies, and after 8 months, they still have antibodies to COVID 80 to 85% of the time. But that means 20 to 25% of the time they do not, 15 to 20% of the time, excuse me, they do not have antibodies. And there's been a number of articles that have come out in the literature that shows that there seems to be a threshold effect, meaning that as when you got COVID, to the degree that it was able to affect your body. When it reached a certain level, you get an antibody production that is actually protective, but below that you don't. So there's a whole lot of people who got very mild COVID or didn't have terrible symptoms or things like that may not have the antibodies at this point because they didn't reach the threshold. And if you're going to go in and get, a bunch of testing done, that's expensive. You got to go get stock. It takes time. In all likelihood, you're just much better off to go get the vaccine and be protected. So it's almost not worth the trouble to figure out if you have an active response, because the other thing you don't know is how long is that going to continue before it goes away. So getting a booster, if you will, getting the vaccine is a wise idea. And I will just tell you, I unfortunately on October 23rd got COVID after not getting it for 7 months. I did something and which is very frustrating, but I'm going to get the vaccine, and no question, because it's been 6 months, and now that the vaccines are available in the community and I'm not taking one away from somebody who would have gotten it otherwise, I'm going to, after May 1st, I'm going to go get the vaccine because I don't want to take a chance.
I have to say, as a person who's hosting this and is supposed to know quite a bit because I'm writing questions, I am going to replay this tape myself because I am learning so much. So I can only imagine what everyone else is learning. All right. So the question up here is, what will boost your immune system? And we have vitamin D, which is the correct answer. And I'll contribute a little bit and turn it over to you. It's not so much that getting a lot of extra vitamin D is going to do anything for you. It's you want to make sure you don't have a deficiency. And when I'm describing supplements, most of which are useless, by the way, there is no vitamin B21. So
yeah.
Most of which are useless. I describe vitamins as a bathtub, in that you want to be adding them as fast as you're losing them. So you got the water in the bathtub. If you add too many of them and the bathtub overflows, that does, A, it's not doing any good, and B, it could cause harm. With that, I'll turn it over to the panelists.
Well, so this is an area I love. And so, the fat soluble vitamins are A, D, E, and K. So those will accumulate inside your body. The other vitamins are water soluble, and it just gives you really expensive urine. So to the degree you prize expensive urine, take a bunch of those water soluble, but be careful about fat soluble ones because they can build up in your body. But to me, really, the other side of your question, Al, is how healthy is your diet? Do you eat a well-rounded diet? Are you getting every color of the rainbow, kind of nature color-coded vegetables? So you know that if you get a red, yellow, blue, purple vegetable every day, you're getting a lot of phytonutrients that are very healthy. You're getting a lot of minerals and vitamins and other things. And then if you add some lean meat to that, you're getting the B vitamins, which are so important. And so whole grain products have a lot of very healthy things. So what I tell my patients all the time is, look, whether you need supplements or not is more about what you're taking in and what you're eating and how you're caring for yourself. And if you think you're doing a poor job, maybe you do need to consider some supplements. But my encouragement and support would be in you eating a better, more well-rounded diet and avoiding a lot of saturated fat and refined carbohydrates.
And Chris, did you want to add to that specifically about the vitamin D deficiencies that people have found in hospitalized COVID patients?
Well, I think I'm going to go back more with what my colleague is saying, is that the bigger issue is using supplements if needed, and keyword is if needed, to deal with these underlying medical conditions. Right now, there's insufficient data to recommend either for or against the use of vitamin D for prevention or treatment of COVID per se, but there are elements of where supplementation, again, ideally through food, with individuals around for obesity, hypertension, these other components of it. But right now, the jury is still out on vitamin D and COVID.
Oh, and to get a vitamin D test, Al, takes time, energy, effort, and expense. And to take 2,000 or 5,000 units of vitamin D during a pandemic, which keeps you from having to go out and hang out in a doctor's office with a bunch of sick people and possibly be exposed to something, is not a terrible idea. And we do know in the United States today that there appears to be a significant number of people who have vitamin D levels that are depressed, particularly now have been inside, not going outside, not being exposed to sun. which your body will make about 25,000 international units of vitamin D when you're in the sun for a period of 10 to 15 minutes and you have a significant amount of your skin exposed. So, during the pandemic, I did recommend that. I realize there's not a good database of data to really justify that for everybody. But, for most of my patients that are middle class, it's a rounding error from a cost standpoint. And I thought it was better to be safe than sorry.
Well, I think it's more of a case of, it sounds like what you were doing was helping to address the underlying medical conditions. And if you're addressing the underlying medical conditions that have shown a worse outcomes, then that's a win.
Yeah, and basically the answer that we have is essentially exactly what you said, that once again, you don't need to overfill the bathtub, but you just make sure that if you're not getting the sunlight, you're not getting the vitamin D, and another thing we generally tell people is if whatever supplement you're taking and it says the percent of the recommended daily allowance, if there are 4 digits in that percent, forget about it. There's nothing that you should be taking 1,000% of. Okay, next question. So a report has been circulating that 6 people died during the Pfizer clinical trials. So mark the true, actually in this case, there's only one statement, we simplified it. It is true, no one died during the study, or in fact, there were 6 deaths out of 40,000 people attributable to the vaccine. And while we're talking about that, we've gotten a lot of questions about how these vaccines are made with fetal stem cells or dead viruses or that kind of thing. And I think we addressed the dead viruses, but could you address the stem cells question?
So Krista, do you want to do that? Or can you jump in there?
Jump in there.
Okay, so I'm happy to. So, when you look at the scientific process, you look at how we develop vaccines and how things have been done, there are places where stem cells have been used in the, if you go back to the beginning of development of things. In terms of these vaccines, the answer to the question is no. Stem cells are not involved. They're not doing there's no experimentation being done. They're not part of the production process. And so there's no concern that by getting a vaccine or paying for a vaccine, even though you're not paying for it, somebody is, that we're increasing the harvesting or the stem cell business in the world. And so you are not in any way, shape, or form getting anything that could be considered a result of stem cells or building or funding the stem cell industry in any way by getting this vaccine. So for those who are very concerned about that, I appreciate that concern. And being from Texas, where there's a lot of very conservative Christians, it's a huge issue. And everybody from the Pope to the leaders of the churches around the world have done that research and come out and said, do not worry, do not hesitate to get the vaccine because of concerns around stem cells. So it's been vetted by the clergy around the world, and they've been very consistent in overcoming or in reassuring their congregations that that's a safe thing to do.
So
I would agree with that too. Is that the cells that the people are concerned about, the Johnson & Johnson vaccine in particular, were not made from fetal tissue or fetal cells in any shape, form, or fashion. And so the original concern has been negated. And as Scott mentioned, several religious leaders have said that the moral objections may not be what were originally anticipated.
Okay, Mark, do you want to give the answer? The answer is, it is true that 6 people did die during the study, but if you actually look at the 6 people who died, only 2 of them got the vaccine, 4 of them were in the control group. So we do suggest that people actually go past the social media thing and do a little bit of digging. Also, if you do anything on 40-odd thousand people over 9 months, a few of them are going to die, just randomly speaking. Okay.
Yeah, and I think it's really important. The point you're bringing about is that things happen in general. And that's why, and for those of you who don't understand the way that studies are done, you take a group of people that all qualify for the study and you break them into two groups, those that get the treatment and those that don't get the treatment. And what Al just said is the people who didn't get the treatment died, 2 of the people who did get the treatment died. So obviously getting the treatment is not what was driving those deaths. Something else happened to those individuals. And I think it's important that people appreciate. There was another, are we going to have a Bell's palsy question in this, Dr.?
No, but it sounds like we should in the future.
Well, so I don't know if anybody on this saw, but I can guarantee you that people inside your company saw a video done by a nurse in Louisiana, and she got the vaccine, and a couple of days later she developed Bell's palsy, and she made a video that she put out on social media saying, "Don't get the COVID vaccine. Look what it did to me." And it was heart-wrenching. I mean, it was really heartbreaking to see a video. And so a lot of us, of course, are very, very concerned about that. And the National Academy of Otolaryngology, which is the ear, nose, head, ears, eyes, nose, and throat doctors, went and did a study where they looked at all the people that develop Bell's palsy, which is where, a nerve quits working on the side of your face and your face droops. By the way, it's about 99% of the time it comes back, but still, it's a little scary when it happens. So they went and saw, do people who get the vaccine, are they more likely or less likely to get Bell's palsy? And the answer is that they're much less likely to get Bell's palsy if they get the vaccine. Now, that's probably statistics. It's probably not really related, but there's no concern that getting the vaccine causes Bell's palsy. And so that's another example, Al, of where, statistical correlation does not imply causation. In other words, things happen at the same time other things happen, but that doesn't mean they always happen. And the best example of that is, cars in accidents get bent fenders, but bent fenders don't cause car accidents. So it's important to realize that just because something happens after a person gets the vaccine doesn't mean it's caused by it.
Yeah, and I think that's a great. Since we only have 7 minutes, I think, and the conversation is flowing so well, I think we need to get to a few more of the listener questions and maybe pause the trivia quiz. But one of the questions that comes up later is that it's something like 2,000 people died within a couple of weeks after getting the vaccine, and that would be a perfect example of what you say, that if you vaccinate millions of people, a couple thousand people are going to die.
Well, and if you go to nursing homes and you start by vaccinating people in nursing homes, they're probably going to die in the next 3 months at a higher rate than people not in nursing homes. So the actual numbers, and this is what we started to mention earlier, Al, is that if you took the vaccine and you looked at you look at the number of people who've been reporting to VAERS, VAERS, which is the Vaccine Adverse Event Reporting Center service. There between 1,500 and 2,000 people had died in the last released report. And but you go actually click on them and look, it says this patient was in hospice, got the vaccine and died 2 weeks later. This patient was 91 years old and died. This patient was 86 and died. So there's a lot of those people who died after getting the vaccine, but it probably wasn't causally related. But even if it was, God forbid, even if the vaccine led to somebody's death, if you look at the 140 million people who got the vaccine and you said, okay, it's only been out 3 months, so let's reduce that to 25% of that number. And then let's say that it had any kind of death or hospitalization rates that were similar to people, the same number of people getting COVID, then the 1,500 compares very, very favorably to the 671,000 or whatever the number would be. It's a huge number that would have died if the vaccine had caused the same death rate as the as getting COVID does. So again, the question becomes, is it safer to get the vaccine and be protected from COVID or put myself at risk of getting COVID? And the answer consistently has been getting the vaccine is much safer for you and your family members.
Yeah, so that actually answers another question that's on the list. And since we only have 5 minutes, I'm just going to go through some of the questions that I think are most important here, that are probably the most popular. Is there any scientific evidence yet on how long the vaccine will protect people?
Well, right now, we don't know how long it will protect against individuals. And the question often comes up is, will we need a booster, like an annual booster, like the flu shot? And we don't know right now. But what we do know is that the vaccine's immunity is a much safer way to get that protective immunity than rolling the dice and trying to get COVID. And so we recommend that when the vaccine is available to you, and hopefully you're in an area where there's more doses available, more appointments, to please get the vaccine as quickly as possible.
Scott?
I see your question here real quickly, Al, I can knock out in 2 seconds. Is there any to show that having seasonal flu vaccine lessens symptoms of COVID for those who contracted? And the answer to that question is no. There's no evidence that there is a decrease in symptoms from COVID from getting the flu vaccine.
Yeah, totally different animal or virus.
Yeah.
So there are a couple people we've had on these webinars in the past, Dr. Marty McCary of Johns Hopkins and Dr. Ian Lipkin of Columbia, who say the opposite thing about how long this pandemic is going to last. So I'm going to ask you, and I'm not going to get in the middle because Marty McCary wrote a book and he said very nice things about Quizzify, and Dr. Lipkin is married to my sister, so I got to get along. So I'm staying out of this crossfire, but I would love to get your two opinions on, is there going to be herd immunity within a 4 to 6 weeks, as Dr. McCary says, or is it going to last until mid-2022, as Dr. Lipkin says?
I think they're trying to pick a date is a little premature. And this topic of herd immunity, we're not sure quite yet what the appropriate level is. Is it 70%? Is it 80%? The more people that get vaccinated, the better the immunity in the community is. And when you start heading north of 75 to 80%, but it then still begs the question, there's still probably a lot of Americans we vaccinated over 100 million. That's great. We still have almost 200 million more to go. And we need to get people to that space. And part of that group of people being vaccinated are our children. Right now, under age 16, we don't yet have trials for them. We don't have a vaccine available for them. Great news coming out of Pfizer, great news coming out of Moderna that we're moving that way. But until we get a larger part of that 300 million people, we're not going to get there just yet.
Yeah. And so I'm going to take, again, my very pragmatic approach. And what I'm about to say, Al, and $3 will get you a Starbucks as long as you don't try to put too much in it. Okay. And that is, I would tend to go along with Dr. Mark, because what is not being considered in the national conversation or the natural immunity from people who got it from getting COVID, they're looking, they being, one of the experts that's out there really as a strong proponent of when do we get to herd immunity? It's going to take forever. He's only looking at people who've gotten the immunization. And we all know that you get immunity from getting the illness. And if you put the 30 to 40% of people who are showing up with antibodies with the people who are getting the immunization, now there's some overlap in that, we're starting to get into some very significant immunity. And the proof is at the end of the proof is in the pudding, and that is that what we see right now in the United States is COVID rates are dropping dramatically. We don't really have a great explanation in terms of people's behavior. They're not behaving better. They are getting immunized, which is fantastic, but it appears that we're getting closer. Now, that said, we've got 60,000 people a day that are getting COVID, and remember that's what the spike was last summer, where we were all freaking out. So it still is a high number, and we can't be overly reassured. But I think we're going to get to watch the numbers of people who get COVID and see how quickly those go down. And I would tend to agree that the natural immunity should count in terms of looking at whether we're getting to herd immunity or not.
Okay, well, hey, folks, we virtually everybody stayed on this webinar. So you two are terrific panelists, and we could do this for another half hour, an hour. And I myself, as I mentioned, I'm going to go back and look at this and learn some more myself. So I just want to thank you two very much. And I also want to thank the people who submitted a zillion questions and set the expectation that it will be quite some time before we get the questions back to you answered, but we will. So once again, thanks very much to our panelists, and we are signing off.
And everyone who attended today is going to get a recording and the slides, and thanks again for attending.
Oh, well, thank you. It's a pleasure.
Thank you. Likewise.
Bye, everybody.
Bye-bye.